So at rest, they are symmetric. Her nose is midline. And if I were to draw an imaginary line from the corner of her eyes to the top of her ears, they are symmetric. Can you raise your eyebrows for me? Okay. So in motion, her eyes are still symmetric. Her nose is midline, and her ears are still symmetric. So her skin is intact. There's no lesions, no rash. She does have a primary lesion here and on her chin, but there's no drainage or exudate coming from it. She has a nice beige color with some pink undertones. Next, I'm going to assess her hair. So I'm just going to feel her hair. Okay, I don't feel any lesions, any parasites. I'm not seeing any parasites. I'm also looking on her neck. I see no lesions, no parasites here either, or behind her ear. So next, I'm going to look at her conjunctiva and her sclera. So can you just pull down your eyelids for me, please? Okay, so I see that her sclera is white with some minimal red veining, and her conjunctiva is a nice pink color with no drainage. Okay, so next we're going to perform the positions test, and this tests for the oculomotor muscles. So Taylor, I'm just going to have you follow the top of my pen light with your eyes, but don't move your head, okay? Okay, so for the positions test, there's no noted nystagmus or strabismus. Next, we're going to perform PERLA. So PERLA stands for pupils equal, round, reactive to light, and accommodation. So first, I'm just going to measure her pupils. So right now, they're about 5 millimeters in diameter. They're both equal and round. Next, I'm going to do reactivity to light, to direct and indirect light. So I'm just going to shine this light in your eye and observe for constriction, okay? So first, the left eye. Okay, direct light to the pupil, to the left pupil. I observe constriction. So now to her right eye. Okay, so her right pupil also constricted when direct light was shown on it. So now we're going to do indirect light. So when I shine it into her left eye, I'm going to be observing for her right pupil to constrict. Okay, so her right pupil also constricted when shown into the left eye. Now her right eye. Okay, so that is normal. So her right pupil constricted when, or her left pupil constricted when shown into her right eye. So she is good for indirect and direct light constriction. Now last, we're going to test for accommodation. So Taylor, I just want you to follow the top of this, and it's going to go towards your nose, and your eyes may cross. Okay, so I observed constriction of her pupils when accommodating, and her eyes crossed, and she is good for accommodation. Next, I'm going to inspect her mouth. So first, I'm just going to start by looking at her lips. Her lips are a nice pink color, no drainage or lesions, no cracks. Can you open your mouth for me, please? So right now, I'm looking at her teeth. Do you have your real teeth?
Yes.
Okay. Patient states she has her real teeth. They are white. I don't see, can you open it a little bit more? I don't see any dental caries, any dental work. I'm observing her tongue. It's a nice pink color, moist, no lesions. Can you lift it up? Okay. Underneath, her tongue is pink and moist, and the frenulum is midline. So now I'm going to use a tongue depressor, spoon, to depress her tongue so I can look at her throat. So her throat is a nice color, nice pinkish color. There's no redness. She does have her tonsils, so I'm just going to grade those as a +1 because they're not enlarged and there's no pus or exudate coming from them. I also noted no odors coming from her mouth. So next I'm going to inspect her neck. So if you could just look up for me, I'm just going to inspect. So just by looking at her neck, her trachea is midline. I don't see any masses. Is it okay if I palpate your neck?
Yes.
So her trachea is midline. I'm not feeling any masses, and there's no lesions on her neck either. Okay, so next we're going to move to auscultating the posterior and the anterior thorax. So first I'm observing the client's position, and she is sitting upright in an upright position. She's using room air to breathe, no added accessory muscles. She is not using her sternocleidomastoid or her trapezius, which would be considered an accessory muscle. All right, so next I'm just going to have you turn to the side. So I'm going to palpate for chest expansion, and I'm going to also feel your spine configuration. So I'm just going to lift up your shirt. Okay, from palpating her spine, it is midline, there's no curvature. Now I'm going to check for chest expansion. So I'm just going to place my hands right below her ribs and put my thumbs right next to each other. So can you take a deep breath in and out for me? Okay, so her chest expanded correctly. My thumbs moved up and symmetric. So her chest expansion is good. Next, I'm going to auscultate the posterior thorax. So each time I move my stethoscope, just take a deep breath in and out, okay? Okay, so after auscultating the posterior thorax, her lung sounds are clear bilaterally and through all lung fields. Now I'm going to auscultate the anterior. Take a deep breath. Can you move your breast to the side? So for the anterior thorax, she has clear lung sounds through all lung fields and bilaterally. Okay, so next we're going to move on to the abdominal assessment. So if you could just lay down. So I'm going to drape the patient appropriately to be able to see all four quadrants. I'm just going to pull. Okay, so now that I can see all 4 quadrants, I'm going to start with inspection. So just by looking across her abdomen, it is nicely rounded. All 4 quadrants are symmetric. I'm not observing any pulsations. She has a nice beige color with some pink undertones. Her umbilicus is midline. It is inverted, and there's no drainage or exudate coming from the umbilicus. So now I'm going to do auscultation of the abdomen. So if she had pain, do you have any pain?
No.
No, since she does not have pain, I'm going to begin in the right lower quadrant, but if she did have pain, I would end in the quadrant with pain. So I'm going to start from the right lower quadrant and work my way clockwise. So her bowel sounds are about 8 to 10 per minute. Next, I'm going to palpate her abdomen, starting in the right lower quadrant. Tell me if you have any pain or tenderness. Okay, so upon palpation, I did not observe any rigidness. Her abdomen is soft. I have observed no grimacing or guarding on the patient's face either. Okay, so now we're going to do blunt percussion of the kidney. So I'm just going to have you sit up. Underneath you. Turn to the side. Okay, so for this, I'm just going to place my hand and then use my fist to tap on it, and this observes if she has any tenderness in her kidneys. Any pain? Any pain? Okay, so upon percussion, she has no pain in her kidney area. So now that the assessment is done, I'm going to apply Vicks. I'm going to provide patient comfort and ensure her privacy. I'm going to document my findings, make sure her bed is at the lowest setting, and that her side rails are up.